The patient journey is a very important part of helping a patient hear better. So we try to take steps to ensure that the journey is a good and a positive one for our patients. When we have a new patient, I like to meet the patient at the door. I'm excited that they chose us and Professional Hearing Services for their hearing health care. Once they arrive, we give them a little tour to show them what Professional Hearing Services is really all about. We let them know we have a full-time service center staffed just to help them with any kind of problems that they might have. Then we ask them if they'd like a nice refreshment like hot coffee or fresh cookies before we sit down and really begin to see what brought them for their appointment. We know that most people wait 6 to 8 years before they actually explore making an appointment to get their hearing tested. Therefore, we want to make sure that every step on the journey is a positive one. After we give them the little tour, we sit down and say, "So, give us an idea what brings you here today. Has missing things affected your ability to understand and communicate with your family and friends?" We try to get to the bottom of what they're looking for from us for this first appointment. Then we let them know what they can expect. First of all, we're going to test their hearing in a soundproof booth to see the softest sounds they're able to hear. Then we're going to see how well they're able to understand when speech is loud enough. I'm sure you've had the patient that goes in the booth and we test their hearing. They hear and understand everything at an optimal level, but when we tell them you do have a hearing loss, they say, "How could that be? I heard everything in that booth." So we make sure they understand that when we're in the booth testing discrimination in both quiet and noise, we're looking for their optimal performance. We're going to ensure that they're able to hear everything in a loudness level that's easy for them to hear. So after we bring them out of the booth into one of our virtual fitting offices, we say to the patient, "Now what we were testing in the booth is testing for your potential to be able to understand clearly when speech is loud enough." Then we will present speech, recorded speech, once again, at a normal loudness level. So we do 40 dB HL or 60 dB SPL and tell the patient this isn't going to be loud, this is going to be a normal loudness level. And then we ask them to repeat the words, just like they did in the booth. Same types of words, but now at a normal loudness level. If they get a word wrong, it's important to correct the patient so they understand what they're missing. They may think they heard it correctly. Perhaps the word was spot and they said hot. Then we say, "No, that was spot." So correct them so they help understand what they're missing. Then we explain the hearing test results and we tell them, "Okay, we did diagnose a moderate hearing loss today. We know that your potential to hear well is very good, but that you're missing almost 50% of speech," or whatever the explanation is for their particular hearing loss. And then while we're sitting at that computer and they're repeating words, we already have a demo pair of hearing aids out and we're programming them for the hearing loss that was diagnosed that day. After the patient has had to repeat recorded speech at a normal loudness level, we say, "Now this was your score on this test. We know your potential is such and such, but you actually missed more than 50% of the words today. So I'm going to put in a prescription for your hearing loss today and show you how you should be hearing." So it's all about demonstrating the handicap and illustrating the benefit. So then the patient starts to hear how they should be hearing, and we leave those hearing aids in. We have written sheets that now the significant other can repeat to the patient while they're wearing the demo hearing aids. We again explain the test results, explain what they're missing, illustrate how they should be hearing, and then we make our recommendation. So that is our patient journey here at Professional Hearing Services. And we have found that most people don't understand what they're missing. We do the same thing with annual tests as well. We make sure we're testing the patient with their hearing aids in at a normal loudness level and speech discrimination in noise so that we can show the patient how they're hearing with their current hearing aids. We try to make adjustments, and if they don't hear well with the adjustments, then we may recommend different technology. The patient journey is an important one and makes a difference on how many people we are able to help hear better.